Dr. Juyia at Elite Women's Care. We provide gynecologic services, and today we're going to talk about hysterectomies.
Dr. Juyia, what is the most common reason for a hysterectomy?
Although there's many reasons for a hysterectomy, the most common reason nationwide is fibroids.
What is the difference between a partial and total hysterectomy?
Many people ask what the difference is between a partial and a total hysterectomy. Either way, this is a major surgery, and these terms are not regulated terms, so they might mean different things to each person. Generally speaking, a total hysterectomy, since hysterectomy means uterus removal, means entire uterus being removed. A partial hysterectomy generally means leaving the bottom part of the uterus behind, also known as the cervix, and removing everything of the uterus above this part.
Is a hysterectomy considered a major surgery?
A hysterectomy, meaning removing the uterus, is a major surgery no matter how it's approached, whether it's an open abdomen incision, which is sometimes still necessary, but more often it's a minimally invasive procedure either through the vagina or laparoscopically.
How can I prepare for my surgery?
Preparation for a hysterectomy is like any other major surgery, which thankfully most people don't have to endure many of these in their lifetime. But that may include quitting smoking as soon as you can. This might be even a month before surgery. Trying to be fit and a normal weight as possible. And then otherwise, it will be recommended to stop food and drink probably the night before or a few hours before your surgery, depending on what time you're scheduled. And you'll be asked to arrive at your surgery center an hour or two prior so that you can meet your anesthesiologist, your nurse, and get your IV started.
How will a hysterectomy affect my menstrual cycle?
An interesting question I get a lot is, will my hysterectomy affect my menstrual cycle? The uterus is being removed during a hysterectomy, so a woman will no longer have bleeding after a hysterectomy. However, when the ovaries are left behind, they will continue to cycle on your normal schedule.
What is the recovery like after a hysterectomy?
Recovery from a hysterectomy, which is a major surgery no matter how it's performed, can be somewhat different for everyone, but generally speaking, after a minimally invasive hysterectomy, which is performed either laparoscopically or through the vagina, recovery is rapid. Most women don't need narcotics after just a few days, but will need to continue an anti-inflammatory medication like ibuprofen for a week or two. They can often go back to work when they feel well, are no longer needing narcotics, and this might be as early as 2 weeks for some women, but for others it might take longer.
What are the risks of a hysterectomy?
There are serious risks to a hysterectomy, just like there are with any major surgery, which is why it's something that is a decision to make with a patient often over time. And these risks can include, like any surgery, bleeding, infection, and injury. If it's attempted to be done laparoscopically, I, like many surgeons, don't often have to what we call convert to an open procedure, but this is also always considered a risk to the procedure. And that's considered a risk because a bigger incision takes longer to heal from. Lastly, that injury is something to consider. Although rare, there's bowel and bladder and blood vessels that are also in the same area as the uterus, and this is why it's considered major surgery. If you're interested in learning more about hysterectomy, please feel free to contact the office by phone, email, or Facebook.